Okay, so this is Dr. Douglas Skarada, and you're about to do a home sleep test. It's really very easy. The first step will be your provider will decide if they think a home sleep test is appropriate for you, and we think the care should come to you. So what happens is you'll get a phone call or a text message to confirm the address where you'd like us to ship your home sleep test. So here's the text message that you will receive. And like I said, you can simply respond to it, or you can click the button to talk to the person, or we'll end up calling you up. But we do need to confirm your address. 3 days later, you'll receive your package to whatever address you selected. Okay, there's a lot of useful information on this box. For one thing, there's the telephone number. If you have any questions, just call customer support, even if it's the middle of the night, although I doubt you'll need to, but we want to make sure that you can get your questions answered. Also, we need you to complete the study and return it within 3 days. 99% of the people, one night is all it takes. Ideally, you'll be wearing it for about 6 hours, up to 8 hours. That will give us plenty of information. But if for whatever reason you feel like it was a suboptimal study, you can keep it and use it a second night. And there is an extra battery just in case. So opening it up, you'll, get your scissors, open it. And what do we have inside? Okay, and you're not going to throw away the box because we're going to use it to ship it back. So there's some literature here that we'll go over. There is, this is really helpful instructions, but I'll be kind of walking you through it. But this is great to refer to if you have any extra questions. There is some highlight stuff. Again, they want 6 to 8 hours. It tells you to throw away pieces, and they've got a little picture of what you're supposed to throw away. But I say you can ship the whole thing back, and we'll throw away what we need to when we get there. Make sure you send it back right away. Please don't keep this. It's really important we get these things back in a timely fashion. We've got the shipping label for the return, which is pretty self-explanatory. And this is a little sticker here will go, back on here when you send it back. So it will seal it, once you've close this back up. And they've got a little checklist here to make sure you get a good result. You want to complete the questionnaire, which is right here. And this questionnaire, I know that we'll be answering a lot of these questions when we do our consult with you, but you absolutely have to fill out this part of it right here. So the insurance is really picky about that. So thank you in advance. It should only take you 5 seconds. All right, so this is what we have in here. And as I said, I've already opened all the little bags, but yours will be sealed. These are little stickers. They're called stereo strips. Put them right here. Here's a strap. Here's a computer. It already has a battery in it. This is an extra battery, so you don't need to put a battery in. And it's really simple the way you do this. So this here has a little snap on it and just snaps right in here and here. And so that's how it goes. And then you're going to wrap it around your chest. So let's pause it. Okay, so we snap this on the belt, and the belt goes roughly over your heart, right over your heart like this, and you take this thing and kind of just wrap it around, and it's Velcro, and it fits all kinds of sizes. If you're a woman, you can go above or below your bust line, and so this here just kind of goes on like this, and this goes around the back, and this will tuck in with another little bit of Velcro. It doesn't have to be super tight, but just so it doesn't move around too much. Cool. And then the device itself, we're going to put the little probes on here. I'll show you. Okay, so this is the finger probe. Got my glasses off so I can see close. There's a little kind of bump on the top, and it kind of matches up with that. You kind of, feed it into here. You put it on firmly. Pops in there. Easy speasy. And then we have our nasal cannula, oxygen. And this thing here screws on to this piece here. It screws on. And just finger tight. Doesn't have to be super tight. Now, granted, this was already on your thing. I mean, you could have plugged that on before you snapped it in here, but it's easy. It's all easy stuff. Nothing to it. Voila. For your oxygen, you put this little thing into your nose like this and over your ears. And you can decide how tight you want to make this based on the little device here. I kind of loosened it up before I put it on. And this is kind of deflecting my voice a little bit. It's catching breath from your mouth. And then measuring oxygen there, you can kind of bring this up. And you can take these little stereo strips and The little stickers. You can use a Band-Aid if you want. You know, you can use any kind of tape, whatever, but we supply you with this to make it easy. You kind of just pull off the top part so you can pull the stickers off. And you can do it here. You can do here, wherever you want. I guess this could be annoying too, depending on how your eyes are. So you pick, but that's correct. And this has all been screwed down into this here. And then you've got your finger probe here. Some people will tuck it through their shirt and out their sleeve. And there's a little picture on it of a finger. And so you want to put it on, you know, that hand. I'm going to use my index finger. If you've got fake nails, or you've got any, what do you call it, nail polish, you would want to clean that off so you get a good measurement. You can kind of do it so you can see the tip of your finger just barely coming through the very tip. So that's good. And then what you do is you kind of close your hand a little bit like a fist, and you take another one of these little stereo strip stickers and just put this onto your wrist. And the reason why you make a fist is so that you don't end up having it too tight at night. And you know, so all kind of hooks up like this. And so now you're hooked up, okay? And then what you do is you push the on button here and it turns green. You can see how there was one, they were all red and that one turned green, that one turned green. See, I was talking, so that top one there is my pulse ox. It didn't notice any respiration, so it turned red momentarily, it would turn back green. The next one is the pulse ox, measuring your finger. There's the last one, so it takes a little bit, no big deal. If it don't all turn green, so they all turn green, I'm set. I can go to sleep and just wear this thing. If I wake up to go to the bathroom, you just let the thing go. And then in the morning, well, I'll show you the morning because I'm going to use it tonight. I can't wait.
Through the magic of videography, I have now completed my sleep study for real. You can see the look on my face. Let's see what happened last night. I did wake up to go to the bathroom once, and my 5-year-old daughter crawled into bed with us. But all in all, I slept 6 hours, and that's cool. If you want to try to sleep up to 8, cool that too. I probably slept in different positions, all good stuff. Let's take a look here. So, what do we have? We've got a little bit of a light going on in here. I don't know if you're going to be able to see it, still a light. So I know that's still going. Let me show you what else. As you can see here, I still have my green light going on here, so I'm going to end it. I'm going to turn it off. So hold this down for a few moments. And the light went off. And see how it's going clockwise? This is actually clockwise. The order of this is going like this. This is clockwise. And that means it worked. Let's take it all off. So just take this off, the little stickers. This piece is actually disposable, but you could send it all back so you don't throw out the wrong stuff by accident. I'm unscrewing all this stuff, taking my finger probe off, my stickers off. So I'm gonna try to do this while holding my phone. I unscrew this, done. Take this off here, done. This comes off, done. So I'm just gonna send all of the stuff back to not make a mistake, but this is a disposable, and this piece of plastic is disposable, but this is extremely expensive, and so is this. So we want to send it all back now.
All right, so we just take the computer, put it back here, and you might say, oh no, look. Oh, how do you do this thing here? There's a battery here. That's for a second night. So if you feel like you did not get a good night, you're going to do another night, you have to take out this battery, put the fresh one in. Otherwise, just leave it go. Here's one of the expensive pieces right here. The finger probe. You definitely don't want to throw this out. So let's kind of tuck this down in here. These things are both disposable. You can throw them out if you want. If you're not sure, you just stick them all in here so you don't throw anything out by accident. All your call. So I answered my questions, and just to be clear, this piece here, the insurance will only pay for it if the score is over 10. So if you're not quite sure, it's one or the other, just err on it being higher. It doesn't hurt you in any way. It's not like it's gonna go on your record in some terrible way. And mine, when I went through here, 2 points, 3 points, 2 points, 1 point, 2.0, 1 point, 0 point, came out to 11. Yay for me. You put down your height, your gender, your weight. You don't want your neck size? I don't care. Stop baying, go through here and answer this. The only one that's confusing here is BMI. If you think you're overweight, say yes. If you feel like you're nice and skinny, say no. Your choice. I could have probably gone either way. 175 pounds and 5'10". Great, you can stop. So this here is just a little cheat sheet. Yep, you slept 6 to 8 hours. You can throw away these things here, as I pointed out, or send them all back. You got to return it right away. Please do that. So that's fine. You don't need to send that back. This thing here, the instructions, they're actually really helpful. Don't throw away the box, so on and so forth. But you don't need them now because we're done. So we've got this that we're going to put to send back. We've got this and this. So put this down here. Close up the box. Easy, speasy, like my 5-year-old would say. Take your yellow sticker here. I want to close it up so that it's nice and safe, like this. I mean, people will often check off these check boxes to make sure it's absolutely, perfect. You completed the questionnaire. I don't have my pen. Lights in the circle clockwise in green, and all materials are present. And then you take your shipping sticker, put it here. You drop in the box. You're done. Now, listen, if you have any questions at all, use the number. That's what the number is for. If you want to do another night because you're not quite sure, use the number. You'll be putting a fresh battery in, doing all the same stuff. Cool that. Really, we only need 4 hours, so if you get 6, it's plenty. Really excited you did it. Sooner you get it back, sooner we get the answers. If you have not heard from us, and it's been about 2 weeks from when you shipped it back, call up our office. Dr. Douglas Skarada with the Modern Nose Clinic. Oh yeah, we know your nose.